Forma is our approach to microcontouring, or commonly known as dermal fillers. And the reason why we call it microcontouring, because it results in 1 to 2 millimeter differences rather than volumizing and distorting. So when we use dermal fillers, what we do is we inject on the periosteum, i.e. on the bone, rather than volumizing, filling you instead. In terms of the types of fillers there's natural-based fillers such as hyaluronic acid, which are reversible and are naturally found in your body. And then you've got semi-permanent fillers, which are biostimulants such as Radiesse calcium hydroxyapatite, or PLLA, such as Sculptra or Lanluma. And these are biostimulants, although something that's commonly come back now in regenerative medicine with the resurgence of regenerative medicine, where it regenerates your own tissue and it continues to stimulate you. And then you've got more permanent fillers such as fat and silicone. And I would always advise never put fat transfer in your face, especially in the infraorbital area. We've seen some horrible cases. Always reserve it for larger areas instead. And as you know, silicone's banned in this country. So when you're considering fillers, always go and stay in this lane first. And I tend to do the hyaluronic acid over here, and I tend to do the biostimulants in the body instead, like hands, gluteal area, lateral thigh dips or hip dips, and elbows, knees. And I stick to hyaluronic acid over here as it's more forgiving. And the reason why you want to stay with hyaluronic acid is it's reversible. So if anything goes wrong, we can use something called hyaluronidase or hyalase, an enzyme that can eat it up and restore you back to what you actually want. Now, the key thing is volume. To get this look, you need 2 to 3 syringes. 1 ml is 1/5 of a syringe, and we normally inject on the periosteum, on the bone. So if I'm looking to lateralize your cheekbone and define your jawline, I'm just using 1 ml on the periosteum, deep on the bone, where it's lifting and tightening, and giving you 1 to 2 millimeter differences in your silhouette or your facial contour to catch the light differently rather than distort you. So in terms of our approach, the first thing you're going to have in your facial assessment. So we've talked about facial aging, where you have fat pipe migration and everything's not as tight as it used to be, or you may have facial asymmetry, or you may lose volume. The first thing someone looks at is your eyes, so we're looking at the infraorbital hollow, so tear trough area. The next thing someone looks at is the shape of your face. So you have a selfie side where you're more defined, you're narrower, you're higher, the cheekbone is higher, and the other side might be slightly heavier. So we want to lateralize your cheekbone, and we want to define your jawline without adding volume or giving you puffy cheeks. The third thing we look at is your nose, your chin, and your lip projection. And over here, when we're looking at chin, we're not going to elongate your chin because that masculinizes you. What you want to do is you just want to invert it, just 1 to 2 millimeter differences, and you want to work in the mentalis crease. Then you want to lift the corners of the mouth, then you want to soften the nose to mouth, but you don't want to obliterate them because you want to do one cheek. So when I smile, I still have a line, and that's natural, okay? And then the last thing you actually want to do is lip contouring. And again, you don't want to distort natural lip anatomy because you'll never get it back. So these are the kind of things you want to look for when you're contouring. There's certain other areas you can do is rhinomodulation, so you can optimize your nasal features. You can also do temporal hollow. You can also lift the lateral brow. You can also soften lines and wrinkles. You can also soften lines and wrinkles here. But again, you can use fillers in the body as well, as mentioned previously. So when we're approaching you, we're going to numb you, and then obviously there's a needle, but the needle goes deep into the periosteum and goes on the bone. So you don't actually feel the pain. The most painful part is me massaging you afterwards, which we'll talk about. But actually on the face, the least painful area is what everyone actually worries about, is the infraorbital area, the under eye hollow. And the most painful area is actually the lips. So don't panic, we numb you, and then afterwards what we do is we massage everything to ensure that it sits on the periosteum deep to lift and tighten you and to refresh you. There's also different types of hyaluronic acid. So we don't tend to use Juvederm under the eye because that volumizes you. We tend to use TSL with NC2, which has reflective particles and it attracts your own cells rather than volumizing you and distorting you in this area, because this area is unforgiving. When you damage the skin or the volume here, it's really hard to get it back. So after we've microcontoured you, it normally takes fillers anything from 7 to 10 days to settle. There's always a risk of bruising and swelling, but this will settle with time. In terms of complications, you can get something called avascular necrosis, where you can block vessels feeding different anatomical areas. So you have to be careful of this. And then you can also have asymmetry, you can have nodulation. Now the key thing is, in terms of fillers, is not to distort your natural anatomy, to make sure your injector knows the different anatomical planes, know the different types of fillers and the kind of results that they can produce, knows the different types of brands and what to optimize, what to not to optimize, and also ensures that they inject deep enough into the periosteum without volumizing you or distorting you. And they know what happens to that filler in year 1, year 3, year 5, year 7, especially because people are now moving away from hyaluronic acid fillers and moving to biostimulants. And you don't want uncontrolled stimulation, as previously mentioned. If you do get complications, they're always, you can always dissolve them out. You do want to go to a seasoned practitioner or a physician who has done it 1,000 times in every single area and is an expert and can actually give you the perfect canvas or the perfect bone structure that you're looking for. Always take some pictures of yourself and, don't try and look like someone else. Look at your photos of how you've aged, and then your practitioner should be able to tell you skeletally how you age. What shocks my patients is when I tell them, oh, dad is up here and mum is down here. Like, how do you know? You've never met my parents. Your physician should know your skeletal structure and should be able to assess your face on the skull, on the fat pads, on the muscle, on the skin. They should actually have these glasses that can see through in terms of your anatomy. It's really cool. And that comes with experience. And lastly, your fillers should feel natural. So when you're pressing down on everything, it should feel like your own skin, it should feel like your own bone. It shouldn't feel like rubber. No one wants to kiss rubber lips. So be really mindful of this, especially when a practitioner tells you this is normal. It is not normal. Nodulation is not normal. Yay, come and feel my face.